as we've talked about this earlier, the vaccines will be available to all adults in phases. And we are currently still in phase 1A. And in Milwaukee County, that means those individuals who are healthcare workers, and people who are living or working in long-term care facilities are the ones that we have prioritized. That includes those people who work for home health agencies, for example, chiropractors, dentists, physical therapists, and all of those individuals we're asking to make sure that they get their vaccinations first, for the obvious reason that they are the ones that are most at risk because they're interacting with the most people who have healthcare needs. The announcement was made earlier this month that police and fire personnel would also be eligible for this. And so we have spent the last week getting a lot of our police officers vaccinated. We actually had gotten many of our firefighters vaccinated as healthcare responders because so many of them, practically all of them, are emergency medical personnel. So they were eligible in the first group that went through. Now we're completing the work that needs to be done with the fire department. Again, the police department is in the midst of getting their vaccinations, and a lot of those have occurred. What's transpired over the last 48 hours, of course, has been the announcement that individuals 65 and older are now eligible for the vaccination. But I'm using my words carefully because there's a difference between eligible and having the supply available. And that's one of the challenges that we face right now is having the available supply. This is something Governor Evers has talked about. This is something that mayors and governors around the country have talked about, is not having an adequate supply of vaccinations. What this means is that even though individuals 65 and older are eligible, we may not have a sufficient supply of vaccines for everyone who wants to get their vaccination this week. And I know there are a lot of people who want to get the vaccine as quickly as possible, and I don't blame them. In fact, I encourage people to get the vaccination. But I'm also want to make sure that we have this done in a way that doesn't cause a lot of strife, a lot of duress, and that will not overwhelm our system. So the best way for people to operate is if people who are 65 and older, if they have an established healthcare provider, to be in contact with them, whether they contact you or you contact them, make sure you're doing what you can to have that communication. People 65 and older without an established healthcare provider can visit healthymke.com to sign up for alerts when vaccine sites are available. We have our vaccine site right now at the Wisconsin Center. The commissioner will talk about who will be eligible to use that center this week, because we want to make sure that people are not frustrated or disappointed or angry if they think that they will get the vaccine and they're not able to get it. So a lot of work is being done right now. And again, I have my hats off to Commissioner Jackson, to Dr. Tamaro, to all the individuals who are working at the vaccination site, all the individuals who are working at the testing site, all the individuals who are doing the tracing. There's a lot of work to be done. But again, we want to get you as much information as we can. One of the things that has been talked about this week, again, just to put this in perspective, in the state of Wisconsin, there are approximately 700,000 people who are 65 and older. 700,000 people who are 65 and older. For the past few weeks and for the next couple of weeks, we are surmising that we will receive 70,000 vaccinations each week. So you can see we're only operating at about a tenth of that pool in terms of getting the vaccinations each week. That's why we're asking for people to work with us, to understand what we're trying to do,